Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County. This is our Facebook Live update. This is your chance to go ahead and ask questions. If you go on the chat section of Facebook Live, you'll be able to do it. As you know, I've been trying out all of these different face coverings that we use. So I tried balaclava, masks, helmet, shield, and whatever. This is a new kind of shield called a Z shield. And the Z shield is, I don't know. It kind of makes me feel like a puppy that's been spayed, so I won't lick my wound here. But I've seen other people use it, and they seem to like it. It would seem to be very effective, for example, if you're working at a place where you were standing and everybody else was sitting. I'm not sure in real life it works. It has this little collar thing that fits on it and comes off. So I don't know. So I think as we get to a world where more people use face coverings, people will come up with new and inventive things. I have a few more on order, and we'll do those as they come out. Anyway, Dr. Bob Dannenhoffer, Public Health Officer in Douglas County. As usual, we ask you if you have questions, please put it in the chat section, and we'll get to it. And then, as always, we go through what's happening in the world of COVID. Well, this has been a very active week. The amount of COVID in the world now is over 18 million cases. It seems like every week we're adding another million cases to COVID and 703,000 deaths. So still a very active pandemic, still very active in the U.S., very active in Brazil, extremely active in Peru. Why Peru should have such a big outbreak is unknown. In South Africa and then in India. I looked carefully this week to see if we're really counting all the cases in India and Brazil, because the number of cases has seemed to kind of stabilize. But what we're finding is that in both of those countries, they're not doing very much testing, and they're not finding all of the cases of disease. In addition, there's lots of deaths that are not being attributed to COVID, but almost certainly are due to COVID because there's so little testing. So in the U.S., we are doing testing. I think we're certainly finding all the deaths from COVID, and I think we're finding almost all of the hospitalizations. In the U.S., it remains a very active pandemic, although the good news is over the last week, I think the number of cases has started to come down. In the last 3 days, the number of cases was under 50,000, which is the first time we've done that in a month. However, the number of deaths continues to rise. It was a little lower over the weekend, but I think that was a reporting issue because the number of deaths was way up again today. Again, the areas that are having most of the disease now, California, Arizona, Texas, and Florida, although all three of those areas put changes into their opening over the last few weeks, and they've started seeing a stabilization or even a slight decline, although I'm very concerned because I'm seeing big increases in the states right next to them, Georgia, Alabama, Mississippi, Oklahoma, and then some places in the Midwest. So we're clearly not done with this. This is appearing to be a rolling kind of epidemic. In Oregon, we're continuing to add cases at 200 or 300 a day. That's still a lot of cases. You remember we went for a long time where we were just 20 to 80 per day, but we're adding 200 or 300 cases a day, and we're seeing deaths. Now, when you look at the deaths, many of those deaths are from cases in the end of June or early July, because it takes a while after somebody is diagnosed. They get sicker, they get sick enough to be hospitalized, and then they tend not to die right away in the hospital, sometimes weeks later. So we're starting to see an uptick in deaths. We actually had 14 deaths one day last week. In Douglas County, we're still doing incredibly well. We're at 135 cases. Most of those are old cases that are recovered. There's less than 30 people in isolation, and we're following about 130 people who are contacts. A couple of things, we can sort of get the sense that, this isn't a big deal, and it does not appear to be a big deal in Douglas County. Right? We've only had one death. We basically have 1 hospitalizations at any time. And so it doesn't seem very bad. However, I looked at Douglas County's population, 109,000, and if we were at exactly the average for the U.S., not the worst place in the U.S., not the best place, but just kind of the average, we would have 1,500 cases rather than 135. We would have 50 deaths, not one. And we'd have 23 new cases every day. We'd go whole weeks without 23 cases. So we would have 23 cases every day. We'd have 1 or 2 hospitalizations every day and a death every other day. I think if we had that, we would say, oh God, this is awful. I know of those 50 people who died, I know a bunch of those. And so-and-so got hospitalized last week, and so-and-so's in the ICU, and so-and-so is very sick. And that's if we were at the average of the U.S. We just have so much less than the average of the U.S., about 1/10 of what the U.S. average is, that it's easy to think that this really isn't a big deal. It's not a real big deal in Douglas County. Well, it's not a big deal in Douglas County because people have done such a good job. I mean, people, for the most part, are doing a very good job with distancing. We don't have lots of travel. And we don't have a lot of really stupid behavior, which is spreading the disease. I think the governor of New Jersey called it knucklehead behavior. Up at the state, they call it flagrantly infectious behavior. However, when we look at cases, we're seeing 2 things that get played again and again. The first is out-of-state travel. We now have cases from Alaska, Washington, Idaho, Utah, Arizona, California, Texas, Louisiana, Florida, and Michigan. So really, almost all of the cases we're seeing start with someone comes in. So one of the cases that we've had over the weekend, I'm not going to divulge any details, but an out-of-state person comes in, think they're well, has a family reunion, infects a bunch of people, goes back to their state, and finds that they were ill. They've infected all the people at the family reunion. But by the time they get the test back, the people at the family reunion have gone to events, they've gone to other family gatherings, which has now done another generation of disease. And then those people go to work and get another generation of disease. And so you can see how one little spark sparks this huge forest fire. And we use a lot of fire analogies with this because the fire analogies are real, that one little spark in dry tinder causes these big outbreaks. And the infectious person is the spark. The dry tinder is all these people in Douglas County who've had no exposure to this virus who will get infected if they get it. So there is not yet a restriction on travel. There's discussion about having a restriction on travel. Restrictions on travel are really hard to do. I mean, how do you enforce this? But I pray that people will do it themselves. And that is, if you have somebody coming to visit from another state, you say, you know what, for the first 2 weeks, why don't you stay in a hotel room all by yourself or stay at the lake or something all by yourself so that you will not be infectious by the time you come visit us. And then the second is to be careful about these gatherings. I mean, again, these family gatherings, reunions, parties, dinners with a whole bunch of people, those are just such recurring themes. And again, I know people like to do this because people like to be with their families, but this is what's causing the disease. So someone says, does a pneumonia vaccine provide any protection against COVID? It doesn't seem to. So the pneumonia vaccine is against a bacteria called pneumococcus. Pneumococcus is what caused most of these bacterial pneumonias. Bacterial pneumonia does not seem to be a big issue with COVID. And so, unfortunately, the typical pneumonia vaccines do not protect against COVID. Now, they're a good thing to get because pneumococcal pneumonia is a really bad disease, and these vaccines are really safe and very effective. So I'd certainly encourage it, but it won't help with COVID. So can you comment as to why Jackson County has higher cases than ours? Yes. So Jackson County has had a couple of outbreaks, one associated with their hospital, one associated with a long-term care facility, and Jackson County has more people than we do. You know, Jackson County was actually one of the lowest places in the country until a few weeks ago, and now they're starting to see these outbreaks. Again, long-term care and hospitals are places where they spread. So how did the case rate in counties south of us and north of us compare to us? And so our per capita rate, we're still doing very well. We're still one of the lowest counties in Oregon. So if you look at the data that comes out as about the number of cases, we're very low. So we were 14 or so cases per 100,000 last week. We're still a very low county. North of us, Lane County is going to struggle with opening U of O. I mean, college students do many silly behaviors to start with, and I was one of them, do many silly behaviors of lots of gathering, fair amount of drinking, cheering and shouting, all those things that spread illness. So they struggle with that, and again, Jackson County is struggling with these outbreaks. So Zach's saying I'm seeing so much about hydroxychloroquine. So yeah, me too. So spent a lot of time this weekend thinking about hydroxychloroquine, looking up the latest. So let's start about things that we know that does help for this disease. So there's this antiviral drug called remdesivir that was initially established to go ahead and treat Ebola. It does seem to work. It works against RNA viruses. It does seem to work a little bit. If given appropriately, it does seem to shorten the length of stay and may slightly decrease mortality. So for those of it done here, it's certainly not a home run. It's like a bunt single. You don't always take a bunt single. You get a guy on base and no out. So you'd always take that, but it's not really a home run. It doesn't really change a lot. Now, Decadron, which is a steroid, if given at the right time of the illness, and that's the right time of the illness, is at the time you need oxygen. Apparently, if you give it before you need oxygen, it doesn't help, and it may actually hurt. But at the time that you need oxygen or need to be in the ICU, Decadron really does seem to decrease mortality. There's convalescent plasma. Convalescent plasma means the blood you take from somebody who's already had the disease. You find the proteins in it that help to fight the disease. Not really a lot of great studies on this. A study that came out today from China early on showed that it didn't make a lot of difference. So what they did is they looked at people who got convalescent plasma and people who didn't. They looked for disease severity, length of stay, death, and there really wasn't a big difference. So convalescent plasma is still not known. Pepsid, which is this heartburn drug, which some people thought might be helpful. The studies are still going on that, and still we don't have any good data on that. There are drugs like interleukin-6 inhibitors. So what happens in this disease, especially in the bad parts of the disease, there's a thing called a cytokine storm, and those cytokines are proteins in your blood that tells your body to help fight an infection. And these are, there's a whole group of these that cause different kinds of disease. So there's one called tumor necrosis factor, there's interleukin 1 through 6, there's a bunch of these other things here which the body uses to help fight disease. And it's thought that perhaps one of these drugs that fights those may make a difference. Again, the data on that, not great. There's a monoclonal antibody which is coming out that looks promising in animals, not a lot of trials yet in humans. And then there's hydroxychloroquine. So hydroxychloroquine is a drug that's used to treat things like rheumatoid arthritis and lupus and malaria. And early on, the Chinese thought that this might work. So early on, the Chinese had hydroxychloroquine as one of the drugs that they gave in a cocktail to people who got it. It did not appear, in the Chinese data, it did not appear to work. There was one report from Marseille, France, that suggested it might work. It was an observational study. So an observational study is a study where you look and you say, these people got hydroxychloroquine and seemed to do better than those who didn't. And so it was a clearly observational study early on. And so then they've done a number of randomized trials. So a randomized trial is the most rigorous way to do it. You give some people a placebo, some people the drug, and you see if there's a difference. So there have been randomized controlled trials about hydroxychloroquine as prophylaxis, hydroxychloroquine early in the disease, hydroxychloroquine late in the disease. So 5 very well done studies. Didn't really show any difference. There's one study from Henry Ford Hospital. So Henry Ford Hospital in Detroit that says that looked at people who got hydroxychloroquine and those who didn't, and found a lower death rate in the people who got hydroxychloroquine. However, because hydroxychloroquine, especially given at high doses, can cause heart rhythm problems, they only gave hydroxychloroquine to people who didn't have heart disease. And so if you had heart disease, you couldn't get hydroxychloroquine. Well, heart disease is the number one predictor of death, besides age, in COVID. So that more people who had heart disease died was a little hard to tell. And so that's the only U.S. study that even has a hint that hydroxychloroquine works. And it really only was a hint. So these people who say, I use it, it works 100% of the time, really there's nothing that works 100% of the time. I mean, I promise you, nothing works 100% of the time. So these people who talk about miracles works 100% of the time. I really have to take that with a grain of salt. Some people get really emotional about hydroxychloroquine. I don't. I just think it doesn't work. So, do I know anything about schools reopening? I know a lot about schools reopening. So, school's important. Kids learn at school. Kids socialize at school. Kids get a meal at school. There's lots of good things about school. On the other hand, we know that when you open schools and kids are gathering together and going on school buses, that there's a risk for increasing disease. Now, the good news is that other countries around the world have tried reopening schools. New Zealand, Australia, France, Denmark, Germany, Israel, and a bunch of other places. And they found that if the rate of disease is low in the community and you open carefully and you have small class sizes, that schools are not a big contributor to disease. However, there's this camp in the southeast that more than half the kids got infected. There's schools in Indiana that opened, had to close the first day because there was a case. So there's a lot of controversy about what's going on and what we should do. So I was part of the Healthy Schools Reopening Council. We looked at what the story would be. So we looked at the younger kids first, K3, and then the kids 4-12. They're different in a couple of ways. Kids in K3 do better learning in person than online. I mean, it's pretty hard to imagine a 2-year-old second grader learning to read online, right? You really need somebody to be sitting there doing it, as well as we think kids less than 10 probably transmit the disease less than others. So I think there's a real focus to get at least K3 back in school. And to get K3 back in school, you need to have a low county positivity rate. That is, of the tests you do, what percent are positive? Douglas County is always, at least in the way the state records, have been less than 5%. And do you have, so it need to be less than 5%, and we need to have less than 32 cases or 33 cases in the county every week. We've never had more than 32 or 33 cases in the county. So right now, K3 could open. To open up older 4-12 is a little more complicated, right? Once you're in high school, you're passing between classes, you're in multiple classes, you may have other extracurricular activities that spread the disease, such as sports or band, and teenagers are teenagers, and they will do things where they may smooch or do something like that would spread the disease more. And so that was a lot harder. So to open up the 4-12, you need to have a low positivity rate at the state. We're not there yet. A low positivity rate at the county. We're there yet. And a county rate that is low, less than 10 cases per 100,000, which in Douglas County would be less than 11 cases in a week. We were there. We were there for many weeks at a time. We're not there now. And there's, I think, only one county in the state that's there. So I think when we get the rates low, we can open schools. We're not nearly low enough to open schools generally at this point, although I think we can open K3. So Debbie says, in these instances of spread, have masks not been utilized? Yes, masks have not been utilized. Can events still happen with masks? I don't think we've seen any where people are wearing masks all the time and have spread the disease. Now, of course, you don't know exactly where you get it from. You don't get a receipt when you get the disease. But in almost all of these areas of spread, they've been at family reunions. Nobody was wearing a mask at the family reunion. Not really expecting people to, but that's how it spreads. Or at a wedding, I'm not thinking that everybody's going to be wearing a mask at the wedding, and yet this is how they spread. So Patty said, depression from all this is real. Is there any suggestions to help? Yeah, the depression really is real. I think we're starting to see, as this goes on and on and on, more and more people with depression and anxiety. You can imagine if you're anxious about day-to-day life, you can be really anxious about what's going on now with the economic disruption and everything else. And certainly depression is certainly affected by the milieu in which you live. And the milieu at this point is not really great. So almost all of the behavioral health providers are open and seeing patients either in person or by telehealth. Telehealth mental health visits work really great, so please, please, please see your doctor or your counselor. And then there are other things we can do with depression. One of the things we recognize is being outside and getting exercise is tremendously helpful, especially for young people. In fact, for young people, it is probably as effective as many of the medicines we use. So we're really asking people to get outside, get some sunlight, and to exercise, and then to be good to yourself. I think during these times, people can sometimes watch CNN around the clock. That can be pretty depressing. Do fun things as best you can. Get outside, get some exercise, eat well, and take good care of yourself. So Kat says, if a public business does not have employees wear a mask, how can this be reported? There's a state reporting site. Employees can report through OSHA. Other people can report through a site, and we'll get that for you and put it on the thing tomorrow of places you can call. However, the state does not have mask police, and we don't have mask police. As a county, we've chosen not to go ahead and cite people for these things. Really, we're in the business of trying to convince people that wearing a mask is a good thing. Work with people to get them to be able to wear the masks. I don't want to be writing tickets, and we're not going to be doing that. Yeah, but we'll get you the number to report. So one of the questions here then is about travel. Travel is so important. Again, our cases have come from, and I'll say it again, Alaska, Washington, Idaho, Utah, California, Arizona, Texas, Louisiana, Florida, and Michigan. Take those cases out. We actually probably would meet the guidelines for opening schools. So the reason we're not going to be open schools is because our case rate is too high, and the case rate comes almost all from out-of-state travel. Travel is so critical to what's going on. And the reason for that is that, remember, I said it's another county our size in another state that had the average number of cases would have 23 cases. And if you're coming from a hotspot, you may have 80 cases in a day. So if you're coming from a place that has 80 cases in a day and we have 2 cases in a day, not shocking that your risk of bringing it in is going to be high. So I'm pleading with people, if you have people who are going to visit, they need to do the right thing, which is when they get here to quarantine for 2 weeks. In our cases, had people done that, when they came back from a hotspot state, quarantined for 2 weeks, we would have about half the cases we have now. So please, if you're going to do that, and if you're going to go somewhere and come back, you need to put another 2 weeks onto your trip and have those 2 weeks at home when you quarantine. We're not going to get it under control if people continue to travel and not quarantine. Yeah, so Alan says, could you comment on the low number of negative test results today? Are they backlogged? Yeah, there's a backlog in the reporting system. Thursdays is generally when they catch up on that, and we'll do it. So good pickup. So Sherry says, I just heard about gargling with betadine. Crazy? Certainly disgusting. If you've ever tasted betadine, it just has a disgusting taste. It obviously doesn't work. So, I mean, obviously, if gargling worked to get rid of germs or whatever, we would do that. But the germs, by the time you get it, are not just in your mouth, they're in your nose, your mouth, your trachea, all those other places that gargling is not going to get. Through this, we've heard about, heat, breathing in steam, bringing in hot air, breathing in those things. I wish it worked, but it does not. So Denise says, are the metrics for schools, including presumptives, were just confirmed? So the state does not distinguish really between presumptives and confirmed. And so it's the total cases, either presumptive or confirmed. I looked at those today. About 90% of our presumptives eventually become confirmed. There are a couple that don't. These are people who, for example, husband and wife are sick. The wife goes in and gets tested. They have exactly the same symptoms. The husband is a presumptive case, says, ew, I saw them stick that stick in your nose. I don't want to get it done. He's considered a presumptive case, almost certainly has it. We have a couple where people who are presumptives got tested and they had a false negative test. But 90% of the presumptives that have gone on to be tested become confirmed. So I think we'll see that. So yeah, we may be overcounted by 1 or 2 cases by doing that, but I think they count both presumptives and confirmed. Yeah. So Rob says, Dr. Fauci says we should wear goggles. What are we going to be asked to do next? I don't know. I've been terrible at predicting the future on this. Eye protection actually does probably make a difference. Your eyes really do pick up germs. They go in through your nasolacrimal duct, which is in the corner of your nose, corner of your eye into your nose, and infect you that way. So we do know actually that you can pick up some disease through your eyes, and that's why some people are recommending face shields. or glasses or goggles. I think, yeah, in a healthcare setting, wearing glasses or goggles would be great. I don't know what we're going to be asked to do next. So Diana says, at what oxygen level do COVID patients end up on a vent? My father has COVID. Yeah, I'm very sorry to hear that. So what happens is normal oxygen levels using the pulse oximeter are going to range between 92 and 100%. Under 92%, usually you're going to be started on oxygen. And you can give a little bit of oxygen, a lot of oxygen, or a really, really lot of oxygen. So typically when your oxygen levels fall below 92%, they're going to go ahead and give you oxygen to bring your oxygen level up. If they can't bring it above 80% with lots of oxygen, then there may be a consideration to use intubation and a ventilator. However, what we've seen on this disease is that there may be other things that work better than a ventilator. So prone positioning, that's putting people on their bellies, may work pretty well, and people may not get on a vent. I looked up the data today for what the mortality is when you go on a vent. Early on, they said 60 to 80%. I think the latest I saw from a hospital that did a lot of these is about 40 to 50% death rate, which means a 50 to 60% survival rate, which is better than it was before, but still having to be ventilated for COVID is a pretty dire sign. What about all the doctors that say they have great results with hydroxychloroquine? I just wish it was true. If it was true, what they should do is they should write up their case series or have an outside person do that. So as I said last time, this is one of the jobs I did for a while, is just reviewed records. And I go in and I review the records and go ahead and write it all down and see what happened. And they should have somebody else come in and review their records. None have taken us up. None have taken anybody up on that. And so I worry that their data may not be exactly right. And so I don't know. I just wish they would write it up so we could look at it and see. I mean, if their data was that good, I'd write it up. So, it's not hard to write up a thing. So early on, remember we had this deal about smell and that. I wrote that up, took me about a night, sent it into a journal. And so those kind of things can happen. So the fact that these people are on TV and are talking about it and whatever, and not doing the one night's homework of writing it up, strikes me as a little odd. The other thing is they talk about miracles from hydroxychloroquine when those other people who have done the studies haven't seen miracles. I would actually much more believe them if they said, I treated 100 people with hydroxychloroquine and only 5% needed to be hospitalized, whereas in the rest of the county it was 15%. But to say everybody they've treated got it better immediately strikes me as being a little odd. So, is it just a matter of time before hospitals are overwhelmed with COVID locally? I hope not. I mean, I really think we can keep this under control. I think we can keep this down to 1 or 2 new cases a day. And if people would be cautious about travel and cautious about big events like this, we could keep it to even less than that. We really could get to where we were in May. There's no reason we couldn't get to the point where we would go a whole week without a case. If we went a whole week without a case, the hospital's not going to get overwhelmed. Our testing clinic is not going to get overwhelmed. And we could open schools. That's what I'm hoping for. Yeah, so Dale says, are we so focused on COVID, or are there other health issues that I'm concerned about being sidelined? Absolutely. One of the things that we've seen is immunization rates are way down during COVID because people aren't going to get their COVID tests. We know that people are not going to go getting the other kinds of tests that they need to go ahead and keep them well, colonoscopies to prevent colon cancer, breast mammograms to go ahead and find breast cancer early. We know that people are maybe not going for just regular well child visits. And we know that the other diseases are occurring. So hard to believe that at this time, we have one of the biggest salmonella outbreaks that we've seen in years. And Douglas County is the epicenter of the salmonella outbreak. So this is a nationwide outbreak related to onions. And why Oregon has the most cases at about 50, or why Douglas County has the most county cases at around 11, We don't know, but we have 11 people with salmonella from this onion outbreak. So that kind of stuff happens. We have a TB case. So these are the kind of things that are happening at the time. And so, yeah, the real worry is that when we're so focused on COVID, we're not finding these other things. So the deal is we have to put out this COVID fire so we can start dealing with the other things. So Crystal says, how accurate is the rapid test? Well, there are two rapid tests. One is the Abbott ID Now, and the second one is the Sophia COVID Kydell antigen test. Both are pretty accurate. If they're positive, probably 99% of the time you actually have the disease. So a positive test is very predictive that you've got the disease. A negative test, not so sure. You know, on the both the Sophia and the Abbott Now, 50 to 70% probably sensitive. So meaning if you have a negative test, you've got a 50 to 70% chance that you don't have the disease. If it's positive, 99% chance that you do. So I think they're okay to do. The tests are just taking so incredibly long to come back. I was looking at one today, 13 days to come back. You know, that is way too long. So if someone in your home tests negative, is it likely everyone in the home is negative? I wouldn't base on tests. I would say on the symptoms. If there's somebody in your family who has symptoms and they test negative and no one else has symptoms, then it is likely you're all negative. Yeah, so Elizabeth says, could you please explain the rules about healthcare worker contacts being allowed to work? Yeah, this is a bit confusing. So if you're a contact of a case, so somebody's got a case, you're a contact, and you are not an essential worker. So you're something else. You're, work at a grocery store or something. You're supposed to stay home and quarantine. However, if you're a contact and you're an essential worker, healthcare worker, food service worker, or some other essential worker, then you're allowed to work while you're in quarantine. It does seem kind of backwards, but that's the rule. And the rule, I think, was put into place because if all those people were quarantined, then food service places wouldn't work. You'll remember in the Midwest, there was a food plant where a lot of people were positive. And at that point, they said that we should quarantine everybody. They said, well, if you quarantine everybody, there's going to be a food shortage. So they made the rule that in those essential industries, that healthcare workers and other essential workers can quarantine while they work. It does seem backwards. Yeah, Jackie says, Trump keeps telling us how well America is doing. Well, I mean, by what measure are we doing well? You know, our economy tanked, went down 9% in one quarter. We have a higher death rate than most other countries. We have more deaths than any other country. We have more cases than any other country. So if he can tell us how we're doing better than anybody else, I'd love to hear it. When pushed on that, I've not heard him say anything other than we're doing more tests than anyone. Yeah, we are doing more tests, but the number of tests you do is not the measure. Or even though we're doing a lot of tests, we still have a test positivity, as I look today, of 7 or 8%. You really get this under control. You really need to have a test positivity of less than 1%. We were there. Douglas County was there in May and June. We got to get back there. So Danny says, do organs have the right to dry hydroxy? I don't. Right to try is a very specific law about experimental drugs. Hydroxychloroquine is not an experimental drug, so I don't think the right to try is there. I mean, there are people in Oregon who take hydroxychloroquine for things like rheumatoid arthritis and whatever else. I mean, I wouldn't recommend anybody take it, except for lupus or malaria or other reasons it's there. So is there any other tips in strengthening the immune system to increase survival? So we don't know anything in particular we can do, so nobody has done the study again to look at that. But in general, people who are healthier have done better with this disease. So people who are less obese, people who have less heart disease, people who don't smoke are all less likely to die of this disease. So doing all of those things to keep yourself healthy by exercising, maintaining a reasonable weight, whatever, are the things to do. In terms of getting a strong immune system, you can get it. We know that farmers have strong immune systems. Farmers have great immune systems. Pediatricians have great immune systems. And so the best way to get a strong immune system is do what the farmers do. Go out and work in the soil, work in the fields. Farmers don't have lots of other people with contacts, right? So they're not around people who have lots of other disease. But being in the soil, planting a garden are the best things you can do. Yeah, so the question is, am I encouraged by flu being less in the Southern Hemisphere this year? Yes, and flu has been less in the Southern Hemisphere this time, probably because people are doing more social distancing. I don't know if that's going to play the same in the United States, but I certainly hope so. Because as I was just talking to a doctor today, if you have both flu and COVID circulating, it's going to be so hard to separate the two. Yeah, do I know anything about the 90-minute test that's now being used in the UK? Yes. So these are called the next generation tests. And these are tests where you can do lots of samples at once. We're working actually with the U of O to come up with one of these next generation things where they can do these tests. They're very quick and they have incredibly high flow through. So you can do lots of tests at once as well as you can do them quickly. So for example, the Abbott ID now is a nice test, but you do one at a time. The BioFire is a nice test, but you do one at a time. So these are tests where you can do them quickly and do many at once. That really would be a game changer. The U of O is also working on different sample sites. If you've seen me do one of those deep nasopharyngeal swabs, we're not going to have very many people say, let me do that every day. They're working on doing a saliva test. I'd spit every day into the cup and see what I get. So I think we're close to getting good testing. And I think when we get that good testing, we'll be able to drive this down very quickly. Yeah. So Dana says, I need some more people on ventilators. It mutating. This virus mutates. And just like every virus, it mutates. There's a thing today about the 9 different strains of it. And it mutates. And as it mutates, it especially mutates in the spike protein. And so the spike protein is the protein that gets into cells. And remember, we talked about the 614 mutation, which made the spike protein less fragile. And we think that did it. So yes, it is mutating. But I don't think that's causing the more people on ventilators. I think there are more people on ventilators because there's more disease. And there's more disease because people are doing these gatherings and people are traveling. So again, take out the gatherings, take out the travel. We would have like 2 cases in this last week. Yeah, the governor said there's going to be a list of states people must quarantine when they enter Oregon. I'd heard this was coming. I don't know if she finally announced it. But yeah, it's, so we're talking about in Oregon that we would open schools when we would have 10 cases per 100,000 per week. There are other places that have 10 per 100,000 per day. And those are the places that we should be really careful. Turns out that's kind of all the states around us are the bad guys. So California, Nevada, Idaho, and Washington all have lots of disease. And Alaska has had a relatively low amount of disease, but boy, it's really spreading fast in Alaska. So that really is a worry. Okay, good on questions. Okay, I want to talk about a few other studies that came out this week. There was a study about kids and how much virus they have. This was an interesting study from Chicago. And they looked at kids less than 5 to 17, and 17 above. And they looked to see how much virus they had in their nose. The kids had a lot of virus in their nose. Actually, more virus than the adults and than the teenagers and adults, but they do seem to spread it less. We don't know what to make about that. The other thing that we saw was a camp in the southeast where more than half the kids got it in just a week, even though everybody was screened before they got there. That suggests that the kind of activities that kids do at camp, sleeping in the conjugal room, the singing and chanting and whatever that they do during camp, is not going to be safe. Another study that came out this week looked at, the background rate of disease. And the background rate of disease we think is pretty high. So when you looked early on in this epidemic and you looked at the amount of people we knew had disease and the number of people who had positive tests, either for the nasal test or the blood test, probably early on we were only picking up a fraction of the cases. And while the case positivity rate is high, you're probably only picking up a fraction of the cases. But when you can drive that case positivity rate low, that is less than 1 or 2%, you're probably picking up most of the cases. And that's what we need to do to bring this down. So we need more testing, more timely testing, and we need to have a lower rate of disease. So again, travel and parties. I mean, I hate to be the spoil sport here, but if we're going to try and get this under control so that we can reopen schools, that's what we need to do. And I desperately think schools should be open. I mean, schools, we want our next society, our next generation to be smarter and healthier than we are. And if they miss 3 months of last school season and then miss this whole school season, I think we're going to have a whole generation of kids who is behind in their schooling. So please. So people have said, what should we do? So I have the thing, be careful about parties so the kids can go to school. Be careful about travel so that your kids can go to school, because it's that important. Okay, well, that seems to be it for the questions tonight. That'll be great. We're going to do this again on Friday, so please submit your questions. One of the other things, we have 3 challenges that are out there. One is $50 out of my pocket if you can substantiate my friend went for the test but never had the test and still got the positive result. We've seen this now in multiple counties in Oregon, and when everybody's looked, they've never seen it. So my $50 is there for anybody who can provide proof. It's been now a week and a half and nobody's done it, suggesting that it probably didn't happen. The second one is reporting. We got a lot of great things this week about reporting, and the recommendation was that we add the school metrics in our daily report, and we will do that. The state is still finalizing those state metrics, but I think by tomorrow we'll be able to publish those. And again, in Douglas County, we are at a rate where we could open K-3, but we're not at a rate yet where we could open 412. And the other one was be governor for a day. We only had one of those, and it was a great suggestion. So have others, if they were the governor for a day, what would you do? So for example, what would you do with travel? Would you ask people to quarantine? Would you be stronger about it? Would you have somebody at the airport when then they came in, they greeted you and they said, oh, I see you're coming from Arizona. You need to, you need to stay in a hotel. What hotel you stayed in for 2 weeks to quarantine? For example, in New Zealand and Australia, they actually have places right there, and they say, when you get off the plane from somewhere else, they say you're going to be in this room for 2 weeks and you better not get out. So again, if you were governor, how would you handle that? I don't know if I was governor how I would handle that, but I really would hope that you wouldn't have to have strict stuff like that, because I would hope that people would do it so they wouldn't spread the disease here in Oregon. Okay, well, that's it for tonight. Dr. Bob Dannenhoffer. Again, if anybody likes the Z Shield here, I'll donate it to you, because I don't think I'm going to wear it. But again, Dr. Bob Dannenhoffer, thanks.